Howdy, folks, and welcome to Mongo's Midnight Rambling once more. Once again, hope you all have had a great day. I've had a pretty good day reading a bunch of nursing stuff, something from the Mayo Clinic, and a couple of nursing journals from the American Nursing. Here's the next one that I'm reading. It's going to be a day or two. I'm still several journals short, but there's a lot of interesting stuff in health and medicine. There really is. So much. One of the things that I was reading about, I forget if it was in the Mayo Health Letter or in one of the magazines, they were talking about those robot-assisted surgeries. I've always thought those were neat. I remember one I saw. I was never a surgical nurse, so I never got to be around it, really. Just saw it and had one of the surgeons talking about how he used it for either hips or knee replacements, and how it looked like a robot arm, like you see in one of the factories. Although I may be dreaming, confabulating, you know how that goes, alright? Getting my things mixed up too, coming up with stories. But anyways, it is neat how they can use technology like that to enhance surgical procedures while minimizing recovery. So, it's the advancements, and they've had that for years. Even when I was a brand new nursing student not too long ago, right? Ooh. And then, they're always talking about weight loss, or there's always something about weight loss here and there, bariatric this, weight loss that. And, one thing that I saw that they were talking about was, I think this was from, what was it? I think it was the Health Letter that I read. Mayo Clinic talking about being careful on the websites you use. Like if it ends in .gov, it's government. If it's .edu, it's probably a college or an academic thing. If it's .org, it's an organization of some sort. And if it's .com, it's a commercial thing. You've got to be wary of all of them, but most especially the commercial one, because there's always an angle, right? I tend to trust organizations like the CDC website. Mostly. Nobody's perfect. Or like the Mayo Clinic, I've talked about that a lot. But they were just saying that with any website, always remember to, and it's a good internet safety tip anyways, regardless, but especially with medical things and disease and all that other ooey gooey medical type stuff, right? Or take any website you're looking at, because chances are, and there's always this chance, sometimes bigger chances, like for the .com sites, that the person trying to sell you on their ideas has an agenda, or whether it's trying to sell something or whatever. And it's, for me, it's also easy it's easy for somebody to do it on the internet, don't have a credential to their name or any experience, and start talking about anything like they know what they're saying, like they've got the background and experience. I guess it's just reflective to remember. Always be careful no matter what, right? Anyways, I've been talking for forever, so I guess this is good night. Take care, God bless, and see y'all tomorrow.